Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. How many of you have had a conversation that goes something like this? Hey, doctor, I used to vaccinate my kids. My older kids all had vaccinations, but ever since COVID, I don't want to do vaccinations, or I'm nervous about vaccinations, or I want to take a more measured or more holistic approach. I feel like it's been something that's been on my mind a lot as different people have come forward. And I think vaccines are so important, but it's important that we meet people where they're at and have these conversations. Today, I'm excited to invite Dr. Joel Warsh onto the podcast. I think you'll find this conversation fascinating. Today, we're joined by Dr. Joel Warsh. I'm excited to have Joel, board-certified pediatrician and an integrative medicine expert. And so I'm excited to dive right into this conversation. But Joel, Dr. Warsh, would you mind introducing yourself to our audience?
Yeah, thank you for having me on. I'm a pediatrician in Los Angeles, trained Great Western Programs, Jones Hospital, Los Angeles, did medical training at Thomas Jefferson in Philadelphia. And during my residency training, I met my now wife, and she was very holistic minded and opened up my eyes a little bit to a different world and thinking about eating and exercise a little bit more than I was maybe in residency while we were so busy. And I started doing some training in integrative and functional medicine. And of course, during our training, a lot of stuff you hear about integrative medicine is what is that? It's kind of woo-woo went out there. And when I started to learn, it was really interesting to me that a lot of it was around diet and exercise and sleep and things that are very foundational. And so I was like, this isn't woo-woo at all. It's really interesting.
Right.
So that kind of fostered my love. And I've tried to bridge gap and try to practice in an integrative way. And so I'm not against Western medicine at all. In my practice, we'll do medications when we need it. I just try to minimize using that as much as possible and spend as much time as possible on prevention and speaking about lifestyle factors as much as I possibly can. So that's what I've been doing more recently. But what you realize very quickly when you're in the integrative space is that people have a lot of questions about vaccines. And I realized that as much as I thought I knew about vaccines, there was still a lot more to learn. I didn't know the answers to a lot of questions that parents started to have. And so that really has led me down the path in the last decade to learning more about vaccines. And I think for me during COVID, like a lot of people got really frustrated with the public health messaging. And I was very frustrated that things were so censored, especially around vaccines around that time. And so that led me to want to really research and write a book. And more recently, like a year ago, I wrote a book about vaccines called Between a Shot and a Hard Place, and have been speaking a lot about vaccines in the last 6 months or so and having discussions about that topic, which I think is something that is really important to us as physicians and really very topical these days. It seems like there's always something in the news every single day about vaccines. It is kind of a crazy time.
Yeah, no, thank you for that. And I just want to dive right into it here, Joel. I think this is such an interesting and important discussion to have in 2026. Like I said before we hit record, we live in the information age. Our patients have access to endless amounts of information. They can hit ChatGPT or any of the search engines, and they can find a tremendous amount of information, but it's not necessarily placed in context, and they don't have the expertise or maybe wisdom of someone that has practiced it and seen both sides of that. And I think most patients, parents especially, just want answers and they just want truth. But my observation, probably just like what you've observed, is since COVID, I have more vaccine hesitancy, more vaccine skeptical kind of questions from my patients. And I had one a few weeks ago, really an interesting, really dedicated, diligent mom who has children and she's expecting another one. And she said, I don't know where to turn for answers. Like she said, my social media feeds me endless algorithms of vaccine skeptical information, but I don't want my child to get measles either. And she's like, how do I find information? So I said, as your physician, I can try to provide you the best information I can, but really you're a parent, you need to decide what's best for your child. But really, most of the time when vaccinations come out, they're usually have gone through a lot of safety stuff. And especially we see a measles outbreak. And so a lot of people have that top of mind. And so how do you approach those kind of conversations now with folks, especially in these last few years since COVID?
Yeah, I think it's the toughest time to be a doctor, certainly a pediatrician that it ever was. And I also think it's one of the toughest times to be a parent trying to navigate this information because even our own associations and societies can't seem to agree with each other and are suing each other and different schedules. And depending on what week it is, there's all sorts of stuff in the news about vaccines. And so I think it's really tough and we need to be empathetic to that as physicians because people are getting information from all different places. And I guess before we even get into that, for me, I'm not against vaccines at all, for sure. We give vaccines in our office. I've had vaccines in my life. I think they have certainly an important role in society, but I, at least personally, don't believe that we should be forcing people to do anything. I believe that it's our job to educate. And so in my practice, we have patients that do the regular schedule, some do a slower schedule, some don't do it. Most patients at least do a slow schedule and we work our way through. But I certainly see a lot more hesitant families. That's a lot of the reasons sometimes why people will come in the first place is they're just more hesitant and they want to have conversations. And it does feel like in modern medicine, there's been this digging in of our heels and pushing back. And a lot of physicians don't seem to want to have conversations about vaccines as much as they used to want to. And if a family wants to ask questions, they sometimes take it personally or kick them out of the practice, or a lot of practices won't even take people that won't vaccinate. And so I think there's this setup for a lot of animosity between families and doctors right now where parents don't feel heard and they're not necessarily not wanting to get vaccines, but they are concerned about it. And just like you said, we're all on the same team, right? Everybody wants healthy kids and
Right.
nobody wants kids to get measles and die, but they also don't want their kid to get a measles vaccine and have a bad reaction. And for a lot of physicians, we've been in training, we've been in the ICU, we've been in the hospital, we've seen the worst of the worst when it comes to some of these diseases, but most parents haven't. And I think a lot of physicians forget that. Most doctors live in a very specific world, especially ones that work in the hospital. And that's not the reality of what most people see. What most parents see is chronic disease. They see allergies, autoimmune conditions, cancer, ADHD, neurodevelopmental concerns, all of these things skyrocketing all at the same time. And they maybe had a reaction from the COVID vaccine, had a friend who had a reaction from the COVID vaccine, had a friend who swears that the whatever vaccine caused their kids autism or autoimmune condition or whatever it is. That's what they're seeing. That's what they're hearing. And so there's this world where physicians are like, well, you're crazy. Do you want your kids to get measles and die? Like, we have these vaccines. They're safe. They're effective. We've studied them for years. Why wouldn't you do it? And a lot of parents are hearing other things, seeing other things. And there's this big gap, I think, between what physicians are seeing and what parents are seeing. And sometimes there's that lack of empathy, of understanding where the families are coming from. And I think that's tough. And it's pushing people away more and more from healthcare and from doctors and not really feeling heard or respected. And I also think a lot of doctors think that all of the stuff that we've ever been told is absolutely true. And all the things that our bodies had told are absolutely true. And things have been studied extensively. And we have all sorts of vaccinated versus unvaccinated trials and all sorts of research that doesn't actually exist. Obviously, vaccines are studied a lot, but there is another perspective. And unless you go look at the primary literature yourself, unless you look into some of these other resources, you don't necessarily have all the information that these parents have, or at least they have a certain type of information. And it's really hard to counter that narrative or have a reasonable discussion if you don't know both sides. And if you just come to the place, oh, they're safe and effective, they've been studied extensively, they're most studied product in the world, why would you not want to take one? And I think that is not the position that really is helpful. You're not going to force somebody to do it if they don't want to do it. You have to, I think, convince them through education. And just citing the fact that, oh, you don't want to die of measles or Haemophilus influenza, or I've seen a kid with meningitis, that's not enough anymore, I think.
Yeah. And it's interesting, like you say, most people are probably in the middle. Like I have my patients, I have some who are, they're not interested at all, don't bother me about it, maybe just even a little bit offended if we even talk about it. And I have other patients who are diehard, we're going to do every shot no matter what. But I do find that most people are in the middle. They have honest questions. And for the most part, that centers around the well-being and love for their child. And we do want to be honor science and take the answers wherever they lead. And as a physician, you kind of get the training of a scientific background, which is where you take a null hypothesis, you study it, and you follow where the data actually says. And we try to share these conclusions with patients. But you're right, if it comes off as tone deaf or I'm going to tell you what to do because I'm the expert versus the parent says I have access to the same information set you do, I just don't have the experience and I want to gather that from you as a physician, it puts you in this interesting spot. I found the other thing, just practically speaking, is these conversations take a lot of time. And
Yeah.
when you're in the middle of a busy clinic and you've got so much stuff going on, suddenly somebody wants to have a 40-minute, 45-minute conversation around the details of this. It is challenging to fit that into they've got a scheduled spot for a certain amount of time. And so that's what I was asking you as a pediatrician, you've been through residency training, you've worked in all these environments. How does your normal approach when someone says, hey, I've got questions about vaccinations, other than, hey, read my book? How do you approach it?
Yeah, I never say people to go read my book. I think that's, I mean, if people want to read it, obviously that's fine. But
Sure.
I think that for me, it's about having conversations and being open to answering any questions that parents have and trying not to be judgmental or substitute my thoughts for theirs, is trying to listen and to answer in the best, most educated, most information scientific way possible. And I think most parents respect that and are okay with that. But there's, like you said, I think there is a big problem in medicine right now in terms of the way that the system runs, where it's really difficult for some physicians, for a lot of physicians that work in big systems, to have those kind of conversations because they're not short. I'm lucky I have a private practice. I can set off some time for people if they want it. And if I know I'm going to have a vaccine conversation, I'll probably set off half an hour to do that. And that's just scratching the surface. Like, you're not going to be able to have a reasonable conversation in 5 minutes. That's just not, it's not enough time other than if you're going to stay safe and effective. So it is easier to brush that patient off. But I think what then families see is that we're not willing to have these discussions and we're just dogmatic. And I don't think that's a good long-term solution. To me, at least, we're taught that we treat everybody, right? We treat everybody. We work for everybody. If somebody murders somebody, your job in their emergency department, still treat them, right? It doesn't matter what they did. We don't judge them. We just treat them. And I think for whatever reason with vaccines, that has shifted, and a lot of practices are unwilling to have those conversations and have those discussions and don't take those patients. And so I think that's a doctor's right. It's not illegal, but I think it does set an odd precedent that is being strongly pushed back against, as is just the general impression of people that have questions around vaccines. Like, a lot of doctors are very quick to label people anti-vaccine, or like label me someone who's anti-vaccine, which makes no sense. I gave vaccines to people yesterday. Like, not against vaccines at all. It's like saying, oh, are you anti-car? No, I'm not anti-car. I'm anti-car that blows up, right? Like, I'm against a vaccine that causes a reaction, but that doesn't mean there isn't a place for it. And I think for so many parents, and certainly for me, I think there are two discussions that can be had. You can talk about vaccine efficacy and how well they work and how much they protect you, but also you can talk about vaccine safety and risk. And every medical product has risk. And I believe that a lot of that vaccine safety conversation has been minimized. And most of the conversations around vaccine efficacy and, oh, it saved hundreds of millions of lives over years. But there is very little discussion about how vaccines play a role in terms of reactions. We learn, oh, it's like 1 in a million. But that doesn't really sit well with me. I don't think it's as rare as we think that it is. Certainly with the COVID vaccine, so many people know people that had reactions. So it doesn't seem like it's 1 in a million. It doesn't mean there aren't benefits to vaccines. Of course there are. But I think if we were to also show with more strength that we care about safety, and we're pushing back against pharma, and we're on the side of families, and we want more safety testing, we want more rigorous safety testing, more long-term safety testing, then I think that's what a lot of parents want, especially the ones that sometimes get labeled as anti-vaccine after their kid has a reaction and they don't want to do it anymore. And that's not an anti-vaccine parent. That person literally took their kid to get a vaccine, and they feel like that child had a reaction and that no one's listening to them and no one's acknowledging what happened to their child. And they want that to not happen to the next child. And I think we don't realize that we don't have the systems in place to really look at things in a cumulative aspect with the vaccine schedule, and certainly not long-term. Most of the studies with vaccines are done by the companies before the product hits the market, and they're studied for 6 months, a year, maybe 2 years if you're lucky. They're not followed out for 5 to 10 years. We're not studying the schedule in a cumulative sense. And when we have this explosion of chronic disease, it isn't unreasonable to say how or if vaccines might be related to that in some way. And let's think about that. Let's look into that. Let's continue to study that. And I think that's what parents want. And it's not that there haven't been any studies, but how many studies have there been of vaccinated versus unvaccinated kids? How many databases have we looked at when we take all the kids that are vaccinated and compare them for certain chronic conditions? Like, you just don't see that. And that's the kind of studies that parents want. How many prospective studies are there following kids forward, looking at kids that are vaccinated versus unvaccinated, looking at their health status? You want people to trust in your system and in your products. They want to see those kind of safety studies done that haven't been done. And I think we shouldn't shy away from that. We should be open to it and embracing it. And if we do find safety signals, I think doctors would want to know that. And it's not about, for example, like a lot of concern on aluminum, right? And so I think if we were to find problems with aluminum, let's say Hep B vaccine increases your risk of asthma by 10 times, we would want to know that, right? We would want to know that was the case. And we would say, okay, well, if that's happening, why? Is there something else we could put in a vaccine to make it safer, not have that happen? Or you do the study and you find there's no difference between the two groups. And that's going to be the kind of research that's going to be really helpful for parents to make them feel more confident to do these vaccines. And I think right now we're stagnant with our safety research. And that's a big push that Secretary Kennedy and other people have mentioned, and doctors push back and they say, oh, no, these things have been extensively studied. They're totally safe. And I don't think people feel that. Even if that is true, people don't feel like they've been extensively studied, and we shouldn't shy away from doing more research or more science. I think that most doctors put vaccines very high up in their job and in the things that they do that are helpful for patients. And so I don't see why we should shy away from doing more research and more safety studies to look into this and to have more and more evidence to show that they are safe. Or if we do find issues, we should be okay with that, and we should adjust as we go. We shouldn't just trust pharma, I think, to say that a product is safe. We should be on the side of the patients, on the side of safety and health. And we shouldn't be pushing for more vaccines. We should be pushing for healthier kids. And it might mean more vaccines. It might mean fewer vaccines. It might mean prioritizing some vaccines. Maybe not every vaccine we still need the same way we did 50 years ago. Like, we're in a different place. So I think if people saw that sort of mentality, some sort of middle ground, then they'd be more apt to trusting that doctors have their safety in mind and not just pushing a product, which I think a lot of people feel. A lot of people feel like doctors are pushing vaccines regardless of the safety concerns that they have.
Yeah, I think you were right. Like longitudinal studies, just a more robust attentiveness to longitudinal studies and seeing what are the outcomes of these populations, folks who did get vaccinations, folks who didn't. And like I said before, follow the data where it takes us. I think that'd be wonderful and maybe good for us as physicians, good for the entire world to look. The other observation I had is during COVID, folks, just the general public, got to see science in real time. And a lot of times when a product comes out as a medication or a vaccine or what have you, it's already been through those initial steps and the initial trials. People who have participated and have got a lot of informed consent around this may or may not work. But in COVID, it was on the news every single day. And sometimes I felt like our public health administrators represented a level of certainty that was not possible to have at that time. They said, this is for sure the way to do it, and this is for sure what we know. And really, the honest answer is, we don't know. We don't know what this is, and we need to let the science play out.
I think that's such an important point, and I think that's where I think trust in medicine, health, and public health was already on the decline, but COVID put gasoline on a fire. And to me, the biggest thing was safe and effective. That is propaganda, and we shouldn't be saying that in public health too. When you have a new product, right? When you have a new product like the COVID vaccine, there's nothing wrong with saying, look, here's the research that we have. It seems like it's effective. It seems like it decreases your risk of death and hospitalization. We haven't found any major safety signals yet. That's what we know, and we recommend it. There's nothing wrong with it. You can't say something is safe when it's new. It doesn't make any sense. Like, you don't know what's going to happen in 6 months or a year or 2 years, and you don't have to, and that's totally fine. But when you say something is safe definitively, then especially when things go on, which you're always going to find something, any product you're going to get millions of people, you're going to have some problem for some of those people. That's obvious, right? And so you're basically setting yourself to fail. And then on top of that, talking about natural immunity, when anything I've ever been taught and anybody else has been taught, you know that especially for a respiratory illness, you're going to have great immunity in general from the disease, right? If you get sick from it, you have robust immunity. There's no reason you should have to get a vaccine right after you have the disease. The reason to get a vaccine is to decrease your risk of having serious disease when you get it, right? You're training the body, you're training the immune system so that way you have a better immune response and you don't get very sick. But if you didn't die from the disease and you had it, there's no reason in the short term that in general that you should have to get a vaccine. You're just taking risk without any benefit. And there was such a strong push for everybody to get vaccinated no matter what. And I think people saw that, it made no sense. And then they said, okay, you're lying to me. What else are you lying about? And then they started to go look at the childhood schedule. And they're like, wait, how many vaccines do we give to kids now? What are the safety studies on that? What are people saying? And I think there's this now massive pushback in the other direction because people don't trust public health anymore and they don't trust pharma. And they just see physicians as an arm of pharma at this point. And I believe that is partly true. Like, we really have become ingrained in pharma. And I think we need to step back from that and be a part of family. Like, it's really doctors and families against pharma. It's not doctors against family. Like, we're all on the same team. We all want people to be healthy. And I think that sometimes we as physicians forget that we're on the side of the families and not necessarily on the side of pharma. And pharma has done so many horrible things over the years. And to just trust them implicitly doesn't make much sense. And to trust the research on vaccines pharma has done, that also doesn't make a ton of sense to me. Like, they have a lot of incentive to fudge the data and move it in a certain direction and make their products look as good as possible. Whether that's true or not, I don't know. But we should be on the side of, let's double check. let's make sure, let's push for more research. Let's make sure these things are safe. Let's listen to families, and no better discussion on the Hep B, right? There's so much back and forth about Hep B for newborns in the last year. And there are just so many families that it just does not make sense to get hepatitis B when they have a newborn. But the medical system has pushed so hard against that when most parents are like, look, I've been tested. I know there's a theoretical risk, 1 in a million, 1 in 7 million, whatever it is, that my baby could get it. I don't want to do this. And they feel pressure to do it and get it on their 1-day-old baby. And I think, again, that's one of those situations where, yes, we understand that there is a potential benefit from this vaccine, but you also have to look at society and look at prioritizing where do you want to put the most effort. And for we're going to push people to get a vaccine on day one, it should have a ton of benefit with very minimal risk. And I think that there's very minimal benefit for most people for hepatitis B. Sure, there's going to be one kid that's going to get hepatitis B. That is how things go. It's unfortunate, but push every family to get a hepatitis B vaccine on day one. It's not listening to most parents, where I think most parents are very skeptical to do that on day one when they've tested negative, even if they know that there is some potential benefit. And so I think sometimes doctors don't step back and kind of look at the whole picture and prioritize, okay, what do we prioritize? Do we prioritize the measles vaccine and whooping cough, or do we prioritize every kid getting hepatitis B on day one? Because if you push too many vaccines, then people push back against it. And I think, again, that's where we've gone. We've gone so far, so many vaccines, that a lot of parents are like, wait, how many? Like when I was a kid, I got 5 or 6 or 7. There are 20, there are 30. Is that too many? And it's really easy to get pushback and concern against that versus prioritizing the top 5 or 10.
Yeah. No, that's a good comment. And I just thinking like back to that COVID time. Prior to that time, I would say most of my patients, when we talked about vaccinations, were like, there's a vaccine schedule and yeah, it's fine. Occasionally someone would say, I don't want to do it. But because it was in real time, you're watching this unfold, you're having public health officials say this is safe and effective when we can't possibly have had real life data other than just the preliminary 9 months or whatever it took to study that. And so people got really frustrated. I'll use an example. Where I live in rural Idaho, people are vaccine hesitant at baseline and maybe a little bit distrustful of systems just because it's a rural, independent-minded place. When COVID first rolled out, the senior citizen crowd where I live, that same crowd of farmers and ranchers and people who are really nervous about that kind of stuff, they lined up when we had the first COVID vaccination that came to the community. They lined up. Everybody got it. We had one of the highest vaccination rates in the state for people of that older age category because there was a lot of trust and said, we want to do this. We don't want to go on with our lives and move forward. And then just a few months later, you have this issue where government officials are saying, if you don't do this, you lose your job. If you don't do this, you no longer can work in our hospital. If you don't do this, here's all these repercussions, because you heard things like, we're so sick and tired of people not doing what we tell them to do that we're going to force you to do it. And that landed very poorly. And so from that point forward, the number of people who even would wear a mask or even say the word COVID went down to about 2%. And so where I lived, all the vaccination recommendations and masking recommendations and not gathering together, people completely turned their nose up at it. And we pretty much just went on with life as if nothing had happened because people ignored all that. And both were extremes. To just implicitly trust everything that they were told was probably too much of an extreme, but to also turn up your nose and say everything that public health is saying is now bad and I'm just not going to listen to any of it was not the right answer. And so when it comes to these vaccination discussions and how you approach it with patients and how do we do it in the medical system as a large system and how do we do it on an individual basis, I think we have to be informed. People have appropriate questions, and it's not that their questions are necessarily based on truth either. We just have to just design some studies so that we can actually answer those safety data questions. But we shouldn't throw people out and say, oh, you can't come to my practice because you're nervous about this question. I think that's ridiculous. I haven't really seen that where I practice. How common is that across the United States where people are rejecting or declining folks from their practice because they won't vaccinate their kids? Have you observed that very often?
Oh, yeah, it's extremely common. I think most practices don't. The majority, certainly more than half, if not 3/4, are very strict. We only take the regular schedule. Then there are certainly a fraction of practices that will take you. So I think there are very few practices that won't take people. There are very few practices that will take people that don't vaccinate. Most practices will not allow those.
Pediatric specific, or
Yeah,
is that even pediatrics?
Yeah, most practices will only take people that vaccinate. A good chunk of practices will take people that are willing to go on a slow schedule. They just won't take people that won't vaccinate at all, and then there are a few practices that will take anybody. So I think the majority don't take patients. It's very hard for families to find a practice if they don't want to vaccinate. There are just, even in California, where people are pretty progressive on certain things, most practices just don't take you. So it's not like we have any issue getting patients. We have lineup out the door. I can't take patients because there's so many people that come to us just because we're open to having discussions. And I think that, again, people think that they get called anti-vax. A lot of people choose to vaccinate if you're open to having discussions. They just want to talk about it. And I would say the vast majority of my patients do get vaccines. Many of them do it on a slower schedule, but that's what they're comfortable with. But at least they do it, and they're not families that are doing zero. And I think that medicine has moved way too far into telling people what to do and way too far away from having discussions. And to me, especially with vaccines, we have to move back to going to a risk versus benefits discussion, helping people to make that decision. And I think we have a really good understanding about the risks of the diseases and the benefit of the vaccines, but I think we don't have the very best understanding of the safety of vaccines. And I think that's where a lot of our focus and research should be over the next little while, so we can have a good understanding, like a better understanding of what are the true risks from vaccines short-term and long-term. And I think that's going to help people to think through that equation a little bit easier and to be a little bit more comfortable in those decisions. Because ultimately, there's going to be a risk for vaccines. And I think it's going to be higher than what we think that it is. I don't think it's like extraordinarily high, but I think it's not 1 in a million. I think there is a higher risk than that. And certainly when you're talking about giving kids 20, 30 vaccines, you're compounding that risk over many vaccines. And I do think that we need to consider that, so that way people can understand where we're coming from, be a little bit more honest with that informed consent. And maybe that's going to be prioritizing a few of the vaccines, making the other ones more shared clinical decision. That could be a reasonable thing that we do in the long run. Maybe that's going to be the impetus to innovate. And maybe if we see that certain vaccines are causing more problems than we think, then we would innovate and we would change the vaccine. We change the ingredients. We do it in a different way. We have some vaccines that you could drink. We have some nasal sprays. Like maybe we're going to be able in the future to spray in your nose for flu and whooping cough and RSV. And maybe that has a lower risk of side effects and works pretty well. And then we don't have to do to me, like, for example, whooping cough. Does that make a ton of sense? We have to do 5 vaccines in the first 2 years. Like that's a lot of vaccines, where maybe if we had a better working vaccine, we could just do 1 or 2. And so I think that we should have some humility in medicine, and we should be open to trying to continue to improve and to pushing pharma companies to continue to innovate and trying to decrease the amount of vaccines, decrease the amount of side effects while still getting the same benefits. I think there is a lot we can still do to make families to trust us again, to push for that. And a lot of parents comment about polio. Like, obviously, we don't want polio to come back. We haven't had polio here in a long time. Do we have to give 2-month-olds polio? Do we have to give 4 in the first 2 years? Could we give that later? I don't know. Maybe not. Obviously, if polio comes back, we wouldn't want that. But maybe we can prioritize whooping cough and RSV and Haemophilus in that first few months, or maybe we can combine those into one vaccine so we don't have to do so many. Maybe there are ways that we could innovate so many pokes and people be more comfortable doing it. Like maybe we can prioritize the couple, and that's the one vaccine that you get. We have combo shots. So maybe we could just do one combo shot once or twice, and that would be enough for the first year. And that would be more palatable for people. I don't know what the answer is, but I think we shouldn't stop asking that question. And given the fact that there is so much hesitancy and so much concern, we could be in charge of that narrative, and we could listen to it, and we could innovate towards making people more comfortable, or we can continue to call people anti-vax quacks and not listen to it and push people away and see more and more people turn away from medicine and lose that trust, where I think that would be a real shame. Like doctors and public health were so trustworthy and such a big part of people's families 50 to 100 years ago. And it seems like there's such a animosity right now between families and doctors. And so many practices, I read them on Facebook groups and whatever, a lot of doctors don't know what to do. People are so hesitant to vaccines right now, and they're losing so many patients, and they feel very frustrated because people are pushing back and they're not getting vitamin K and they're not getting the measles shot, and we're seeing outbreaks. And I think a lot of doctors just don't know what to do. And I don't think the answer is to dig our heels in further and just talk about how great vaccines are. I think we need to understand what the concerns are and address them versus digging our heels in and pushing back and not attacking people that have these discussions. And, I'm called anti-vax a lot. And it doesn't make any sense. I'm not against vaccines. I'm not against anything. I just want to have these kinds of conversations. And I'm always wanting to change my mind. I'm always wanting to change what I say. And I just try to present what I've seen and what I've read. And a lot of what I read, I had no idea. And I didn't know before because I didn't look into it myself. And when I did, I was pretty surprised at what some of the research was and what some of the research we didn't have. was. And some of the things that we say, and we're so confident in saying them, I'm like, why am I so confident in saying this thing? When I look at the research, doesn't really totally show that. So maybe some of these parents aren't as crazy as I once thought. And I think that humility is really helpful to being able to have these conversations, because the people who do vaccine practice is pretty high. Like, it's a pretty high rate of people getting vaccines when they trust you to not push them on vaccines, but to have discussions about it. But it's hard with our system because we don't have that kind of time. But maybe doctors are going to realize we have all the power in the system, and maybe we can push back to help create a better system. And that's one of my hopes too, is I think we let the insurance companies really dictate things. And insurance companies don't exist without doctors. And if we banded together, we could really change that system. Like, it's not a good excuse to say we don't have enough time to talk about vaccines. Like, we only have 3 minutes. Like, we need to
Right.
create a system where we have that time. If this is something that's so important to us, like, we have to be able to be like, no, I need to be able to book an hour with a patient. I have to be able to get paid for that to make that happen. And we have that kind of power if we work together. Just doctors are not very good at working together, I think.
Yeah. I want to just echo 2 points. Like, number one, let me join with you the call that let's continue to call for good longitudinal safety data on every intervention, and vaccinations especially, because it's a young, healthy population that we're giving an intervention to. And I think that it shouldn't all be pharmaceutical funded. And sometimes these longitudinal studies take funding, and it probably requires public funding, university funding, and not pharmaceutical funding. So I totally agree with the exclamation point at the end of that thought. The second thing is, Joel, I just am flabbergasted. You said the majority of pediatric practices won't take people that don't adhere to the published vaccination schedule. I don't know, that just shocks me. Where I practice, I would say the majority of people, I'm a family doc, most of the people I work with or my peers would say they've taken a Hippocratic oath. I'll help people wherever that they're at. I don't want someone in my waiting room with measles. We got to be a little bit careful and be attentive to not have diseases that are going to spread to other folks. But on the other hand, I just can't imagine turning somebody away because they had a question or because they were different. To me, that flies in the face of what I do as a doctor, and I'm just shocked to hear that, because it's not what I'm
Yeah.
observing where I'm at, and I can't believe that would actually be the case.
So, I mean, I want to clarify. I don't think that most doctors turn patients away for asking a question. Most doctors, at least where I am, in my impression, in most practices across the country, if you don't follow the schedule, that's their policy. Their policy is follow the CDC schedule, or they have certain ones that they require. Maybe they don't require you to do flu shot, or the ones that are not required for their state, but they do require them. And if you are unwilling to follow that, they send you a letter. They say, we're not the right practice for you. They dismiss you. So that, I don't know the numbers, but my sense is that the majority of practices follow that. And then if I had to guess, like 50% of practices do that, maybe 10 or 25 or so practices, 25% or so practices will let you vaccinate, but on a slower schedule is okay as long as you're doing them, but just not zero. And then a smaller percentage would allow you to do whatever you want. That to me is the sense. I don't know where you are. I would that's true, but maybe if you're the more rural you are, the less of a choice a doctor has, because they're the only doctor. Whereas if you're in a city, there are a lot of options. So then there are like 50 doctors around within a couple miles. So therefore, I'm just not the right practice for you. That's my sense of what a lot of practices do. And it's not illegal, but I think in some way it's a little discrimination against vaccine choices to not take those patients. But at the same time, that's a protected class. So you can, if you really strongly believe in vaccines, which most doctors do, then they feel like, and this is what I've heard from any practices, that they're not the right doctor for you. You don't believe in science. You aren't going to listen to their other recommendations. You're going to have other issues. So it's just not the right practice for them. And so I understand that perspective. Certainly. I just don't agree with it, but I think that it's not legal and you should be able to do whatever you want. But I just hope that there's always enough practices for these patients, because ultimately good doctors that believe in things can convince patients that they have that time to do it. And if you have that relationship, then maybe a family's not going to do Hep B at birth, but you have that time because you didn't force them, and they see that you have their best interests at heart and you're not requiring them to do things. And then comes around to whooping cough or something else, which is probably more important for that baby than Hep B in general. And he didn't make me do Hep B, but you're saying how important this whooping cough shot is. Okay, maybe then I should listen to you. Or maybe you don't even do any for the first couple of months, and you start talking about the measles vaccine and why that one you feel like is more important. And they do end up getting that one, which to me has more benefit than most of the other vaccines. If you're going to pick one, that's probably the one that I would choose. Sometimes that can be really helpful. I might have a patient that doesn't vaccinate, but does do the measles shot. And if I'm going to pick one, I think right now that's probably the one to do, given what's going on. So I think there is also something to be said if we're working with patients where they are. But there's no question about it. That takes time. That takes discussion. It takes relationship. Sometimes it takes months or years before people are willing to do it. And I think it's going to have to be up to each doctor to decide that. But I just don't think in general it's a good look for doctors to be kicking patients out for their vaccine status. I think that's one of those things that's really gaining some steam in terms of a narrative against the medical practice, in that doctors are basically forcing you to do something or they kick you out. That to me just isn't a good, it's not a good PR move for
No.
doctors. We're not very good with PR. I don't know. I just think we're just not very good at this like social media PR kind of game. And it is a little bit of a game. And it's unfortunate that influencers who don't know anything about healthcare push a narrative where doctors don't work together to have discussions. And also, I think a lot of physicians are terrible having debates. I think that's another big miss in modern medicine right now, is the people that are the most pro-vax, they're most knowledgeable, refuse to debate. They refuse to have discussions. They refuse to sit down. And oftentimes their wording and their narrative is the science is the science, the literature is the literature, and there's no need to debate. Debate is not reasonable. I don't want to give a platform to somebody who has a different opinion, and let the literature show. If you want to show something different, do it in the literature. And I push back hard on that every time, because people can interpret the literature in different ways. And that's the whole point of having debate. And the smartest people that know the most could, on a stage, be very convincing when you have discussions about some of these topics. And it just does not ever seem to happen. Like, I've never seen Secretary Kennedy sit down with a Paul Offit or anybody. They just refuse to speak to him. And I think if you did, then you'd have actually a lot of positive that would come from that. And I think they think it's going to be so negative. I think people only get one side of the discussion. And sometimes the people that are stronger against vaccines are much louder. And that narrative is dominating. And the Paul Offits of the world and the other people that are very strongly in that they don't have that platform. They don't speak out. You don't get to hear them. And you certainly don't get to hear them in a discussion. And I would love to. I would love to discuss and debate some of my questions that I have with them. I would love to hear their opinions, because I don't feel like I know everything. I feel like these people know a lot more than me. And when I read the literature, I might read it in the wrong way. I might not know some studies. And I think that it would do a lot of good for the public to hear smart people discuss this and have discussions and arguments about those topics. And I think that would move the narrative forward. And also maybe some of the super strongly pro-vaccine individuals would also learn something too. And maybe they would hear some of the concerns. Here's what does and doesn't exist. All right, let's push to get some of that research so that people can feel more comfortable. I don't know why that's unscientific or problematic. I don't know why we can't find some middle ground there, agree on some things, disagree on some things, and the things that we disagree on, push the NIH and the CDC to get that research that we don't feel like. Someone very pro-vaccine feels like we have the research, someone anti-vax doesn't. Okay, let's listen to that and let's see what information we do and do not have. Let's publish a review on what we do and do not have. And then let's study what we haven't actually studied. Like the vaccines and autism conversation, we haven't talked about that at all, but we haven't studied that extensively like we talk about in medicine. Like we say, oh, it's so extensively studied, but that's mostly on MMR, mostly on thimerosal. And there's so many other vaccines. And I want to see vaccinated versus unvaccinated studies. I want to look at that. And that's going to be the kind of information that's going to be really helpful. I want to know about hepatitis B and pneumococcus and all these other vaccines and how that plays into autism and chronic disease. That's what I want to see. That's what parents want to see. And that's anti-scientific. Doesn't mean that I feel like vaccines cause autism or anything like that. But I think that's the narrative that people hear. And they go look at the research and they hear, oh, it's settled. And you actually go look at the research, and the vast majority, pretty much all of it's on MMR and thimerosal. Thimerosal is not even in vaccines anymore. And MMR versus no MMR in the setting of getting other vaccines does not prove or disprove that vaccines are related to autism. You have to study no vaccines. So that's what I want to see. I would love to see those kind of studies, because that would be really helpful to continue that narrative and discussion forward, as opposed to pushing people away and just giving them a propaganda line, which people are seeing through now.
Yeah. So I'm excited about what you're talking about. And I just want to, as we wrap up time, I think you and I totally agree that there's a place for vaccinations. They're really important. They help prevent a lot of diseases. If my patients are listening to this, I want them to know that, yeah, I think vaccinations are really important. But I would want anybody with a question not to say, hey, you're rejected because you have a question. I think it's important that we have ongoing science. That's the beauty of science. It's an ongoing process of inquiry that could last for decades or centuries as we continue to reevaluate and understand. So I appreciate the call to action. I think you and I should do another episode, because there's so many more things to talk about on this. And I think it's the best thing maybe that I've come out of this is just keep meeting patients where they're at. People have questions. A lot of times it's really sincerely held questions, And the best thing we can do is try to create time. And if you only have 20 minutes with somebody, have them come back. Keep going down those conversations and try to help people come to the best thing for them and for their family. And man, Joel, do you have any, I know there's a million things we could talk about. Any final thoughts as we wrap this up? And also, where would you have people turn to access your website, your book? Where would you have them follow your work?
Yeah, first I want to say thank you for having this conversation because not everybody is willing to do it. And I think it's really important that we continue to have vaccine conversations and not to label people as who are out there anti-vax just because they're asking questions. Again, I echo what you said. I'm not against vaccines. I think they have a place. I think they do a lot of good. I think they have done a lot of good. But I think there are a lot of concerns around vaccines. Parents have those, and I'm trying to echo and bring out some of those concerns that families have and that I hear over and over again, and that I don't think that doctors fully appreciate or hear, and trying to express those concerns because not responding to them is not helping this conversation. It's getting louder and more people are hesitant and more hesitant. And I think the answer is to listen to the concerns and to respond to them and to study the things that people have concerns as opposed to labeling it and just dismissing it. And I'll just finish with saying two things can be true. Vaccines can be effective and they can also cause problems. And we can have studied vaccines in the past, but we can study it better and different in the future. And we can always strive for better and safer vaccines. And every single person here, every doctor who's listening, every parent who's listening, everyone around and take care of, we all want the same thing. We want healthy kids. And not everyone necessarily agrees on how to get there, but I think we all have the same North Star. And we don't have to label each other or dismiss each other just because there are different opinions or we're having discussions about it. We have to stop dismissing people who bring up concerns around vaccines. The answer is to listen to it and to listen to parents and to study it, not to dismiss it. And ultimately, you may very well find that vaccines are the safest thing ever in the world. And that's great. That's fine. But people don't feel like the research is there. Whether that's true or not, you can say that till you're blue in the face. Oh, they're the most studied thing ever. We know for sure this. So they're safe and effective. You can say it over and over again. People don't believe that anymore. And that's not working. And we're seeing that it's not working because more and more people are hesitant. And I have more people coming to my office who vaccinated their older kids and don't want to vaccinate their new baby now. So there is a trend away from vaccines, and that's a failure of the messaging. And so the answer to that is not to dig in harder. It's to listen and to change our approach, I think. And I think that if we were to listen to some of those concerns, we would be a little bit less dogmatic about it. And we'd be a little bit more willing to push for research, because I think every doctor is about research and science and data. And I don't think that if we did the right kind of studies in Harvard and Hopkins, and they were to find that there was a bunch of problems with vaccines, that doctors would be like, never mind, just do vaccines anyways. No, we would want to know what the problems were. We'd want to make changes. So I think that everyone is on that same page, but sometimes people are talking over each other instead of to each other. And I hope we can start talking to each other and having more discussions like this in a very kind way. I've had lots of discussions with doctors. No yelling here. Everybody's friendly. No one's throwing a tomato at me. I've gone to some mainstream conferences. I've talked on the most anti-vax things, and I've talked on very pro-vaccine things. And I think that we can have these conversations respectfully and kindly, and I can have my mind changed and you can have your mind changed, and we can have a discussion and don't have to agree on everything. And the more of this that we do, the more that we model having good, respectful conversations, the more that's going to help people in the long run to trust us when we make recommendations, especially around something like vaccines, because they hear that we actually hear their concerns and are working towards making them as safe as possible. And that's what most patients want. So for me, you can find me at Dr. Joel Gator on Instagram or X. The book is called Between a Shot and a Hard Place. And I also have a Substack called Between a Shot and a Hard Place. And you can find the book on Amazon or anywhere the books are sold.
Awesome. Thank you again for taking the time to do this. I look forward to keeping in touch, and I appreciate you taking the time.
Thank you.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.